Hello friends, this is Dr. Eduardo from São Paulo. This is the fourth week of our PPCR 2021 course, and this week we've been studying blinding or masking in clinical trials. And I've came across a very interesting concept that I was oblivious to before that's called the Zelen Design, or as the Zelen himself refers to it as the randomized consent design. Well, this came up during the 70s to the 90s, and Zelen was facing a problem that was patients need to consent to be in a trial. And sometimes the notion that you have two groups, an interventional and a control group, uh, could hinder enrollment from these patients. Also, physicians tend to feel uncomfortable when they have to disclose to their patients that they actually don't know to which group they will be randomized to, because it will be random. So sometimes they don't participate because they don't want to lose their physician-patient relation. And also, there's a problem that once a patient signed a consent, he may feel uncomfortable at the allocation that he was randomized to, but still don't want to break his consent. And so he complies, but not really happy about it. So the solution for this started with a single design. Um, like you first do the randomization process and you seek consent only from those who were allocated at the interventional arm. And you keep getting data from the ones that are on the control group. So at first there was a breach in the law which declared that only those submitted to additional risk should provide consent. But nowadays, actually, after 1996 in the US, there's been the HIPAA laws, and even in Brazil we have the LGPD, which are laws that prevent us or anyone from capturing data, personal data, without consent. Actually, it's a crime. So the solution for that was the double design, in which you randomize the patients and then you seek consent from everyone, the ones that are on the interventional arm and the ones that are on the control arm. And even more, you actually provide them with the chance to cross over, to deny his allocation. So the one that was randomly allocated to treatment with the interventional therapy could decide to go with the control group. Okay, so this brings another problem. Though it increases greatly the autonomy of the patients, it brings the problem of dilution, because you will have to analyze as intention to treat. So the ones that were primarily allocated to the group of intervention will be analyzed as the interventional group, regardless of the crossover. So the power of the study will be hindered. But there's a solution to that, actually, because there are benefits in this design. The greatest benefits is that the accrual rate of enrollment. So if you have a trial that is not being able to enroll patients because physicians are not willing to refer patients, or the patients that actually come over don't feel comfortable to be randomized, then through this method you increase this accrual rate greatly. And also you gotta know which patients, the proportion of patients that actually accept the randomness. So there's even a statistical test that you can apply to find the break-even point at where the increase in the rate of enrollment is so positive that it um, enhances efficiency of the trial. Also, when you have multiple centers in a trial, it's normal that every different center will have different patterns of enrollment. So you can analyze the ones that were slower at the beginning and then they just picked up after the installment of the Zelen design. And you should also analyze the proportion of patients that actually accept the random allocation and don't cross over. With this knowledge, you can apply some statistical tests that will tell you if your study has been benefited by this design. So the important thing here is that actually everyone involved is aware of the benefits and downfalls of this strategy, especially the referring physicians. And this will greatly enhance the autonomy of the patients. It's a law-abiding system, and sometimes it is the only way to actually run a trial. Hey, cheers. Bye bye.